Ladies and gentlemen, Daniel Beeler.
Hey everyone, I'm Dan Beeler. I'm CTO at SyncThink. We are a mobile brain health analytics company. Let me tell you a little bit more about myself. I joined SyncThink in 2010. So this is an initiative that's been going on for quite some time. In fact, in 2010, SyncThink looked more like a military R&D project rather than an actual company. I joined with a background in astrophysics, particularly optical astronomy, and I brought to the team an expertise in image analysis, which was sorely needed back then because in the beginning we were developing a lot of the technologies needed to deploy this technology on our own. That included eye tracking. Since then, we've developed the SyncThink platform into what it is today, from early clinical research to technology development to partnerships in industry to the commercial product we have today, SyncThink. I like to do things that are risky, that may require the technology that I develop. I like to ride motorcycles. I like to bicycle. These are all things that matter to me, and I want to do those things with proper knowledge of the risk, and if something does happen, how to best take care of myself. That's right. So that's towards the end of the deck, but it seems to be responsive. So I'll give you a brief preview. So what is the problem? In society today, we have a huge problem with brain health on a number of levels. So it's changing the way we raise our kids. We've decided that the way we process information as we're developing our brains is sometimes abnormal. And we diagnose that with conditions like ADHD. And we prescribe medications to alter that. It's not a cure. It just alleviates the symptoms and produces a behavior that's more in line with the rest of society. At the other end of the continuum, we have an aging society. We have more old brains than we have young brains. And we're beginning to have to deal with a situation where we need to take care of those and manage declining cognition. And then the problem that's on everyone's mind is what we're doing to our brains at the peak of our performance. In sports like football, does play affect our cognition in the long term? Are we damaging our brains? The difficult thing about head injury is it's invisible. If we've received a head injury, our brains are built to adapt and change to accommodate that injury. There are very few tests that we have to objectively assess what happens to our brains after we're hit. And these are conditions that affect 1 in 4 Americans. It's an epidemic in brain health. This goes from concussion, ADHD, fatigue, autism. And the methods that we have to evaluate these conditions are incredibly subjective. For instance, if a player receives a concussion, the evaluation that they have on the sidelines is pretty much a field sobriety test. They check their vision, they check their balance, they check their orientation, but it all requires the support of the player and the subjective analysis of the clinician. And I can tell you that clinicians are not satisfied with this situation. They want tools that can produce a more objective measure, that can track outcomes, that can make their decisions a little bit easier. And this is costing us money. There are about 4 million sports-related concussions in the US. You've probably heard in 2015 the nearly $1 billion settlement with the NFL to address past treatment of concussion. There are 6.5 million children diagnosed with ADHD, and that has been increasing at 5% per year. And then as our population gets older, we have nearly 50 million cases of dementia annually. And this is projected to consume an enormous portion of our GDP by 2025. So what SyncThink brings to the table is a direct objective measurement of brain health. And we do this by assessing visual attention. Attention is a critical brain function that we use to coordinate and orient ourselves to a moving world. And this is severely impaired after a traumatic brain injury. So you can see in this example here, what we do is measure eye movement. So we use eye movement while providing a visual stimulus to assess how well a user synchronizes with predictable stimulus. And it's a very simple visual paradigm. So we have a dot moving in a circle. It's not meant to stress or confuse the user. It's meant to be as predictable as possible. And then we use this to measure variability. And you can see on the left there that at the top, there's eye motion in that circular pattern. And at the bottom is eye motion relative to the target. And it's very tight on the target. So there's good synchronization with the target. After a head injury, what we see is this particular variability. So we can measure eye motion variability inwards and outwards of the target motion, so spatial variability, and along the path of motion, which is your timing variability. And the impairment that happens after concussion is this timing deficit. So the user's still predicting where the target's going to be, but they're not withholding their gaze on where it is right now. And that's something that we can measure with our technology. And it's sensitive enough that during recovery, you can track this deficit back to your past performance. So you have a good indicator of rate of recovery and how completely the individual has recovered. And we provide this technology on a platform called SyncThink. It's a mobile eye tracking platform. We modify VR platforms to include eye tracking sensors. And you can see on here we have a Gear VR. This is our latest implementation of SyncThink. It's a fast, objective platform. Because we take data at a very high rate, we don't need a whole lot of time with the individual. The typical assessment lasts about 60 seconds. We received an FDA clearance in 2016, early 2016, for assessment of abnormal eye movement. And it's a tool that clinicians can use to identify risk, impairment, and monitor that recovery. And the version that I'm going to be talking about today, the version that we've brought to the market over the summer, is a cloud-connected device. And I'll tell you why that's important to our users. Now, the interesting thing about a health company is that it takes a very long time to bring anything to market. Our clinical research goes back nearly a decade. But we have a lot to show for that. We have these objective, validated metrics for assessing visual attention. We have normative results, clinical norms, for over 10,000 individuals ages 7 to 70. We are the first to the market. We developed the foundational technologies for using this in the clinical environment. We've been granted 12 patents. And we've provided it in a form factor that's useful for clinicians. People don't receive head injuries in the office, not typically. So we want to deploy it into the field where it can be useful. Our research team has published over 23 peer-reviewed articles validating this from MRI DTI imaging, neuropsych assessments, test-retest reliability, versus ADHD versus fatigue, things that can confound a result that may be comorbid with things like traumatic brain injury. There's no learning effects with this technology. It's one of the downsides to neuropsych testing, so cognitive testing, is that you quickly learn how to game or dog the results. And it's a technology that's passed muster with the FDA. And maybe some of you in the room can understand it's a very invasive process, and it's certainly a high hurdle for any technology. And let me take you through the journey to get to where we are today. So back in 2006, Dr. Jamgajar, who's currently a neurosurgery professor at Stanford University, published his first paper on predictive brain state and how this might relate to evaluating people with traumatic brain injury. It was soon after that they published the first results using human subjects with eye tracking technology. And then over the next 6 years or so, began continuously publishing papers with support from the US Army, validating and filling out our knowledge of eye tracking and cognitive brain state. And towards the end of that, I came on to help develop technologies in support of this. But it's only with the rise in VR that we saw an opportunity to bring this to consumer markets. Before, we were using expensive custom-made hardware that is very expensive. And this is a condition that affects people at all levels. And we wanted to provide a platform that can help. So we sought an FDA clearance for that platform that was on an Oculus DK2. And in this past summer, we moved from the DK2 to a Gear VR implementation. And the goal with this technology platform is to provide cloud services to our customers. And how does that help the customer? So if you are our typical client who's maybe a physician, team physician, or an athletic trainer on the sidelines, you're under a lot of pressure to provide a clinical assessment of someone who's been in a hit, say a football player. So using our Android-based device, you can provide an assessment that objectively evaluates that visual attention, common impairment. Not only is it a common impairment after a force to the head, but it's a functional impairment. If you can't predict effectively when you're out in the field, you're just going to find yourself with another injury. So the user holds the goggles up to their head. We show our visual paradigm. And then we provide an automated analysis. It's objective, it's quick, and it provides that useful first piece of information that can help advise what the clinician does next. Now, on our currently deployed platforms, we want that information shared among other stakeholders. So we want this information synchronized to the cloud. We want it replicated to other iSync devices within that institution. So if you're a large college like Stanford University, then you have more than one iSync available. One might be with football, one might be with soccer, one might be in sports medicine. And you want data available on all of those devices. You want it synchronized with your electronic medical records. You want your team physician to have access to it. And you want to enable SyncThink to provide the best analytics possible. So by synchronizing with a central server, not only are you backing up your data, but you're enabling us to improve the analytics that we can provide on the front end. What are the requirements to implement this? We need robust mobility. If you're out in the field, so we have a mobile technology that's delivered on an Android-based device, Gear VR, and an Android tablet. We need compatibility with an Android SDK. We need that two-way sync. So not only when you take that data, it is synchronized to the server, if you have another iSync device, that needs to synchronize with data that's taken out in the field. We need offline functionality. If you're a clinician and you're in a huge stadium or you're out in the field and you don't have network connectivity, then you still need to use this device. So it's not acceptable for us to only provide analytics that's available through the cloud. They must be local to the device. And everything should function as if you have that network connection. And we can't cross streams. So we need to make sure that data that's taken at Stanford University does not end up on a device that's at Notre Dame. Not only is that a gross violation of medical practices, but we're talking about competitive technology. Because we're a medical device and we're providing services over the cloud, we need to comply with HIPAA. That includes audits, logging. Any medical information that you collect needs to be retained for 7 years. We need to provide end-to-end encryption, so data at rest, and it's transferred between the local device, the cloud, and any other devices. We need daily backups of that, and we need to ensure that if those backups are taken, that we can properly recover in a disaster. And the rule with HIPAA is that you can only use information that's collected and make that available to individuals as needed. So the requirements for someone who is a network administrator is different for someone who's in charge of customer success. Now, we're a small company, and it matters that we try to minimize the cost of our cloud architecture. Fortunately, and I don't know if anyone else in the room has this experience, but Microsoft has been incredibly generous with their Azure cloud credits. So we received a sponsorship earlier this year as part of an accelerator program with Microsoft to provide $360,000 in cloud credits over 3 years. It's simply an offer that you can't pass up, and it became a requirement for us that the technology that we deploy has to be on Azure. And make use of the technologies on Azure. I can tell you our team has most experience with AWS. I'm sure most people in the room do. But we need to make use of things like scale sets, their key vault, operational insights, to try to automate these compliance and mobility tasks. And Couchbase provided those for us. So it provided us a local database with an Android SDK. It provided the maturity that we could depend on to design our application around it. It provided a sync server to do that two-way sync between the cloud, iSync devices, and other iSync devices. And a robust database that we can use not only for advanced analytics, but also compliance. And we leveraged resources both within Couchbase and their partners to develop that over a 4-month period. So we developed our application in the previous year using Couchbase Lite, but when it came time to deploy this in the field, we needed to implement our cloud infrastructure. And Level provided the initial services for getting that on the cloud, a Microsoft Azure cluster, both for Sync Server and for Couchbase Server. And the folks at RamJam helped us to automate and optimize that for maintaining compliance. Since then, SyncThink has been able to onboard over 24 clients in the last 90 days. So this is at all levels of athletics. So from professional sports, the latest one is the Golden State Warriors. Right? People are probably familiar with those guys. But it's not only the NBA, it's obviously the NFL, but hockey, all levels of sport where players are at risk and need to receive treatment from their partners in sports medicine. So we have users in Canada. We have users operating sports medicine clinics in Utah, the Bay Area, and Boston with Mass General Hospital. Mass General Hospital services most of the professional sports teams in the Boston area. But our target market is NCAA, who have the same problems that we do at professional sports, a similar amount of scrutiny on their practices, but they have a moral obligation as well to make sure that the players that they're servicing have a successful educational career in addition to their athletic career. Stanford University was one of our first users. They deployed the technology about 2 years ago, developed an entire concussion protocol around it, and I've recently migrated to our cloud platform. We have big names in sports like University of Texas, Notre Dame, Iowa State, Northern Colorado, and a few others that my PR guy said that I couldn't mention yet. But let me give you a case study. So Texas football team is about 120 players. Most football teams are about 120 players. And they receive highest levels of care. The sports medicine professionals that provide services to Texas football players are some of the best. But time is short. These players need to practice. They need to do their classes. So any testing that needs to be done on their players needs to be done with timelines in mind. So when we onboard a school like University of Texas, we bring in a half dozen iSync units. We train up their staff. We sit down with the players. But we make sure that we have enough throughput that as players come in, no one's waiting around. No one is frustrated that they have a big test coming up or they're late for practice. And Couchbase services have enabled us to bring in 6 units, test all these players on 6 different units, but immediately leave one with the football team with all of their data collected on it, all of it synchronized, and we can have the confidence that going forward, every single player on the football team has an initial measurement to compare against if they receive an injury. And at the point of incident, we have the reliability that if you have a stadium with 100,000 people in it, all using their cell phones, or you're on the road and you don't have a reliable cellular connection, that iSync is still available to evaluate their players. So they can and have used this technology on their players at the point of incident to make evaluations in minutes without having to worry about network connectivity. For Mass General Hospital, they're servicing players at the highest level. Privacy is incredibly important to them. And they're servicing players at different locations. So you might have the Red Sox, which is downtown, but also Foxborough, which is 45 minutes outside downtown, the Bruins, which are right down the street. And they need a technology that not only they can use in the clinic, in their physical therapy department, as patients come in and players come in, but also go to the point of incident, evaluate players in the locker room, and provide therapies to get those players out on the field faster. And iSync can provide the mobility, the security, and the information to make qualified decisions. So what's next for us? We're going to continue using Couchbase to build out our services. That includes dashboard analytics, so that we can identify if, say, an iSync unit is dropped on the field, it becomes dislodged, broken, that we can perform automated QA to identify that and proactively warn someone if they're taking data that's not at the highest level. We can alert customers and provide them with information if, say, we find an anomalous incident that maybe this is something that you should address after baselines with some follow-up therapy, or something that requires more attention. And we're leveraging tools like Nickel to build out our analysis suite. I mentioned earlier that we have a normative database of 10,000 individuals, but we want to continuously add to that and refine our knowledge of the population. So it's not just a population 7 to 70, but it's what does the average player look like who, if you're playing at a high level, you're not necessarily average. And the interesting thing about concussion is that something that might affect an elite player might make them look more normal. So what does an elite quarterback look like? What does an elite player in Division I compared to Division III compared to someone in high school? And we can aggregate and make that analysis using technologies like Nickel. So I want to leave some time for questions. Feel free to get up and ask anything. No problem. I can hear you, but maybe not everyone else.
You talked about developing an objective measure for concussions, and I guess that's based on some initial scan for somebody. But so is it the case that if you're on the sideline after an incident, a person runs the iSync, you can make a an objective determination as to what kind of severity of concussion they've had and whether they should stop playing or whether they can return to the field to play?
Yeah, and the technologies that we provide are not displacing the opinion of the clinician. The clinician, at the end of the day, is making the diagnosis. Our technology is not making that diagnosis. But we can provide that objective information to make a better diagnosis. And as it happens, our brains are pretty complex. So head injury manifests itself in different ways. So you might have an oculomotor impairment, which affects your ability to pay attention when you're on the field, but you might also have a balance injury. And it's important to differentiate between an oculomotor impairment and a balance injury, and if there is impairment, to provide the necessary treatment to address that. So balance therapy, vestibular therapy can help that player get back on the field quicker.
Two questions. Do you have any presence on Research Stack, Android? Since you're in Android SDK, do you share any of your SDKs within the Research Stack for other, like academics to come and maybe build on what you guys are already doing?
Currently, we are not open. We do not provide an open SDK. There would certainly be a lot of regulatory considerations, so we don't quite have the flexibility that your typical consumer software might be able to do, and those things can be very exciting. And there's always a way, but sometimes in the medical space it just takes a bit longer.
Okay, second question. Have you tried this applying to impaired driving under the influence of marijuana?
Yeah, it's a question that comes up quite a bit. And as more of these states legalize marijuana, we don't have things like a breathalyzer to provide objective measures. Fortunately, one of the few measures that is considered a scientific evidence in court for inebriation is eye motion testing. So horizontal gaze nystagmus. When an officer is moving their finger like this, they're making a subjective measure of that. It's something that we could potentially provide in a much more robust way with a technology like ours. But it's something that we're not providing to the market right now. Awesome. Well, that is pretty much my time. Thanks, everyone. I really appreciate it.